Hello, good day to each and everyone. We are the Group 2 from BSN1-11F, and for today, we are going to tackle our worksheet number 6, which is all about the nervous system and the special senses. Hi, my name is Deborah as Capitan, and I will be your first reporter for today. So, in my part, I am going to tackle the neuron anatomy and physiology. For the first question, the cellular unit of the nervous system is the neuron. What is the major function of the cell type? Our answer is neuron generates neuronal impulses to help control organs and organ systems. Number 2, the supporting cells neuroglia have numerous functions. Name 3. First, it acts as phagocytes. Second, it protects neurons. And third, it acts as a selective barrier between blood supply and neurons. Number 3, match each statement with a response chosen from the key. So the key is provided in our worksheet. We did not included it in our PPT now. So for the first, the brain and spinal cord collectively, our answer is the central nervous system or the CNS. Number 2, a tiny gap that separates two neurons. Our answer is synaptic cleft. Number 3, a collection of nerve cell bodies found outside the central nervous system. Our answer is the ganglion. Number 4, neuron connecting sensory and motor neurons. Our answer is the interneuron. Number 5, neuron processes running through the central nervous system. Our answer is TRAP. Number 6, collections of nerve cell bodies inside the central nervous system. Our answer is the nuclei. Number 7, neuron that conducts impulses away from the CNS to muscles and glands. Our answer is the efferent neuron. Number 8, neuron that conducts impulses towards the central nervous systems to muscles and glands. Our answer is the afferent neuron. Number 9, chemicals released by axon terminals. Our answer is neurotransmitters. Number 10, specialized supporting cells of the nervous system. Our answer is the neuroglia. So for the number 4, draw a typical neuron in the space below. Include and label the following structures on your diagram. Cell body, nucleus, dendrites, axon, axon terminals, myelin sheath, and nodes of Ranvier. So as you can see on the picture below, flashed on your screen, we have the nucleus, we have the cell body, we have the dendrites, this is the axon, this is the myelin sheath, the nodes of Ranvier, and the axon terminal. So number 5, how is one-way conduction at synapses ensured? So since only the axon ends of neurons possess neurotransmitter vesicles and postsynaptic cells possess transmitter chemical receptors, conduction across a synapse can occur in only one way, from the nerve cell body. Number 6, what anatomical characteristics whether a particular neuron is classified as unipolar, bipolar, and multipolar. So our answer is the number of processes extending from the cell body. So we are also asked to provide a picture or drawing of a unipolar, bipolar, and multipolar. So as you can see on your screen, we have the unipolar, the bipolar, and the multipolar. Number 7, describe how the squamous cells from the myelin sheath and the neurulima encasing an axon. You may want to diagram the process. So squamous cells wrap themselves around the axon of a neuron in a jelly roll fashion. The tightly packed plasma membrane of the wrapped squamous cells from the myelin sheath. So the neurulima represents the remaining surface membrane and nucleus of the squamous cells. Number 8, correctly identify the sensory or afferent neuron, interneuron, and motor efferent neuron in the figure below. Which of these neuron types is or are unpolar? So our answer is the sensory neurons. Number 2, 8.2, which is our most multipolar? Our answer is the motor neurons and interneurons. So for the figure that the number 8 is referring, as you can see on the picture flashed on your screen, we have the sensory neuron here, we have the interneuron, and we have the motor neuron. So this is also the effector and the receptor. So for the structure of a nerve, number 9, what is a nerve? A nerve is a whitish fiber or bundle of fibers that transmits impulses of sensation to the brain or spinal cord and impulses from this to the muscles and organs. Number 10, state the location of each of the following connective tissue coverings. Number for the 10.1 endothelium. So it is located in the innermost layer and it surrounds the axons. For the 10.2 perineurium. Middle layer surrounds the bundle of axons to form fascicles. For 10.3 epineurium. It is located in the outermost layer. It surrounds bundles of fascicles. Number 11, what is the value of the connective tissue wrappings found in a nerve? So the connective tissue wrappings provide insulation so they can transmit impulses very fast. Number 12, define mixed nerve. So mixed nerve are nerves that contains both afferent and efferent axons and thus conduct both incoming sensory information and outgoing muscle commands in the same bundle. Number 13, match each of the terms in column B to the appropriate definition in column A. For the first definition in column A, reversal of the resting potential resulting from an influx of sodium ions, our answer is depolarization. Number 2, period during which potassium ions are diffusing out of the neuron, our answer is repolarization. Number 3, transmission of the depolarization wave along the neuronal membrane, our answer is action potential. Number 4, mechanism that restores the resting membrane voltage and intracellular ionic concentration, our answer is sodium potassium pump. For number 14, would a substance that decrease membrane permeability to sodium increase or decrease the probability of generating a nerve impulse? Our answer is it would decrease the probability of generating an impulse. Number 15, why don't the term depolarization and action potential mean the same thing? So our answer is a depolarization is any change in a neuron that makes it more positive than resting potential, but an action potential only occurs when the depolarization reaches the threshold level. So for the next reporter, I am going to pass the floor to Ms. Sofia Altera Bermejo for the gross anatomy of the brain and cranial nerves.
So good day everyone, I am Sofia Alter Clasio Bermejo and I'm going to tackle about the anatomy of the brain and the cranial nerves. So for number 1, in which of the cerebral lobes, frontal, parietal, occipital, or temporal, would the following function areas be found? So for the auditory area, it's the temporal lobe. Primary motor is the frontal lobe. Somatic motor area is the parietal lobe. The olfactory area is the temporal lobe. Visual area is the occipital lobe. And Broca's area is the frontal lobe. So number 2, match the letters on the diagram on the human brain, right lateral view to the appropriate terms listed at the left. So for the frontal lobe, our answer is H. This one as you can see on your screen. Number 2 is letter B. Number 3, temporal lobe or letter J. Number 4, the presental gyrus, letter F. Number 5, parieto-occipital sulcus, letter C. Number 6, postgenital gyrus, letter A. Number 7, lateral sulcus, letter I. Number 8, central sulcus, letter G. Number 9, cerebellum, letter E. For number 10, medulla oblongata, letter L. And 11, occipital lobe, letter D. And number 12 is pons, letter K. So number 3, which of the following structures are not part of the brain stem? Circle the appropriate response of the responses. So our answer is cerebral hemisphere and the cerebellum. Number 4, complete the following statements by writing the proper word of praise in the corresponding blank at the right. So It is an elevated reach of a cerebral tissue. In what our answer for that is gyrus. Um, Inwards folds of cerebral tissue are called sulci or sulci. Number three, our gray matter is composed of viruses. I know, sorry. Number three is viruses, and white matter is composed of neuron cells body. Number five, a bundle of fiber that provides for communication between different parts of CNS is called fiber tracts. And number six, which areas one that carries impulses between the periphery and CNS areas is called the process. Number seven, nuclei deep within the cerebral hemisphere. White matter are collectively called the nerve. And number eight, it is the basal nuclei. Number five, identify the structures on the following sagittal view of the human brain by matching the lettered area to the proper terms at the left. So number one, as you can see on your screen, this one is the cerebellum or letter P. This one is the cerebral aqueduct. Number three is cerebral hemisphere, letter A. Number four, cerebral peduncle, letter L. Number five, crocoid plexus, letter H. Number six, corpora quadrigemina, or letter K. Number seven, corpus callosum, letter B. Number eight, fourth ventricle, letter N. Number nine, hypothalamus, letter D. Number 10, mammillary bodies, letter F. 11, intermediate mass, letter C. Number 12, the medulla oblongata, letter Q. 13, optic chiasma, E. 14, pineal gland, J. 15, pituitary gland, G. 16, pons or O. 17, thalamus, letter I. Next slide, please. So for number 6, using the anatomical term for item 5, match the appropriate structures with the following descriptions. For question number 1, cite the regulation of body temperature and water balance, most important, autonomic center brain. Our answer for that is the hypothalamus. Number two, located in the midbrain, contains reflex centers for vision and hearing. Our answer for that is corpora quadrigemina. Number three, coordinates complex muscular movements, sorry. Our answer for that is cerebellum. Number four, it contains autonomic centers regulating heart rate, respiration, and the other visceral activities. That is medulla oblongata. Number five, large fiber tract connecting to the cerebral hemispheres. That is corpus callosum. Number six, it is a part of the endocrine system. That is the pituitary gland. Number seven, the canal that connects the third and fourth ventricles. It is the cerebral aqueduct. Number eight, the intermediate mass is part of it, and it is the thalamus. Next, please. For number 7, explain why trauma to the base of the brain is often much more dangerous than trauma to the frontal lobe. Our answer is the trauma to the base of the brain is more dangerous than trauma in the frontal lobe because it contains the centers more vital to life, such as respiratory, cardiac, and vasomotor centers. So, number 8, identify the meningeal or associated structures described below. So, number 1, it is the dura mater. Oh wait, sorry, hold on. So much for that, guys. I'll end my topic pala, giving the mic to Miss Christine. Sorry.
Okay, good morning everyone. So my name is Juan Trixie Crisini. So let me continue the topic meninges of the brain. So number 8, identify the meningeal or associated structure described below. So number 1, the outermost layer, tough fibrous connective tissue. It is the dura mater. And number 2, innermost vascular layer covering the brain follows every convolution. It is the pia mater. And then number 3, drains cerebro- cerebrospinal fluid into the venous blood in the dural venous sinuses. It is the arachnoid villi. And then number 4, the structure that forms the cerebrospinal fluid. It is the choroid plexus. And number 5, the middle layer, delicate with cottony fibers. It is the arachnoid mater. And then number 6, it is the dural fold that attaches the cerebellum to the crista galli of the skull. It is the falx cerebri. So next topic, it is the cerebrospinal fluid. So number 9, fill in the following flowchart to indicate the path of the cerebrospinal fluid from its formation site. Assume that this is one of the lateral ventricles to where it is reabsorbed into venous blood. So we have here the lateral ventricle, next the third ventricle, and then the cerebral adequate, and then the fourth ventricle, and then the medial and lateral apertures, and the subarachnoid space, and then the surrounding of the brain and cord, and the central canal of the cord. So next we have the arachnoid villi, and then the superior sagittal sinus, and contains venous blood. Okay, next slide. So we have here number 10. On the accompanying diagram, label correctly the structures involved with the circulations of cerebrospinal fluid. These structures are identified by leader lines. So we have here the first one, we have the lateral ventricles. And then the second one, we have here in the middle, third ventricles. And then we have here the third one, cerebral aqueduct. And then we have in the fourth one, we have the fourth ventricle. And then lastly, the very bottom part, it is the medial and lateral apertures. So we have here the next topic, the cranial nerves. So number 11, using the following terms, correctly identify all structures indicated by leader lines on the diagram. So you have here at the top, we have the longitudinal fissure, and then we have here on the left side of the brain, we have the frontal lobe, the pituitary gland, the temporal lobe, the mammillary body, and then the cerebral peduncle, and then we have here the middle, we have the pons, and then the cerebellum, and then the medulla oblongata, and we have here the last one, the left side is spinal cord. And on the right side of the brain, we have the olfactory bulb, and then we have the second one, the optic nerve, and then the optic chiasma, the optic tract, the oculomotor nerve, the trochlear nerve, the trigeminal nerve, the abducens nerve, the facial nerve, the vestibulocochlear nerve, and we have here the glossopharyngeal nerve and the vagus nerve. And then we have here the accessory nerve and the hypoglossal nerve. So the last part, using the choices from the key, provide the name and the number of the cranial nerves involved in each of the following activities and sensation of disorders. So we have here number 1, smelling of flowers. So it is olfactory, the CN1. And then slowing the heart, it is the vagus, that's number 2. And then chewing food, we have here the trigeminal, we have CN5, and we have here reading the newspaper, we have the optic, CN2, and then number 5, feeling a toothache, so it is a trigeminal, so it is a CN5, and then tasting well-seasoned food, we have the facial, so we have CN7. Then number 7, we have listening to music, it is the view Q clear CN8. And then we have here the rotating the head, it is the accessory CN11. Then we have here raising of the eyelids, it is the oculomotor, it is the CN3. So that is the end of my slides. So I will passing the stage to Mr. Faisal Bayani.
Okay, spinal cord and spinal nerves. Anatomy of the spinal cord. Number 1. Complete the following statements by inserting the proper anatomical terms in the blank. The superior boundary of the spinal cord is at the level of the foramen magnum of the skull and its inferior is at the level of vertebra. Second, sacral. The collection of spinal nerves traveling in the vertebral canal below the terminus of the spinal cord is called the conus medullaris. Number 2, using the terms below, correctly identify in the diagram of the structure provided with leader lines. So we have the dorsal root of spinal nerve, ventral horn, pia mater, arachnoid mater, dura mater, the central canal, the white matter, the dorsal horn, lateral horn, ventral root of spinal nerve, dorsal root ganglion, dorsal ramus of spinal nerve, and ventral ramus of spinal nerve. Number 3. The spinal cord is enlarged in two regions. So our answer is the cervical and the lumbar regions. What is the significance of this enlargement? To accommodate the greater number of nerve cells and connections needed to process information related to the upper and lower limbs. Spinal nerves and nerve plexuses. Number 4. In the human, there are 31 pairs of spinal nerves named according to the region of vertebral column where they originate. The spinal nerves are named below. Note by number the vertebral level. Cervical nerves C1 and to C8, the lumbar nerves L1, L5, the sacral nerves S1 to S5, and thoracic nerve is T1 to T12. Number 5, the ventral rami of spinal nerves C1 through T1 and T12 through S4 form plexuses, which serves the limbs of the body. The ventral rami of T2 through T12 run between the ribs to serve the intercostal muscles. The dorsal rami of the spinal nerve serve posterior trunk. Number 6. What would happen if the following structures were damaged or transcend? Number 1. Dorsal root of a spinal nerve. It would lead to numbness in certain areas of the body. Number 2. Ventral root of a spinal nerve. It would out of the pathway of the motor information from the spinal cord to the spinal nerve. Number 3. Ventral ramus of a spinal nerve. It loses both motor and sensory function. Number 7. Defined plexus. It is a bundle of intersecting nerves, blood vessels, or lymphatic vessels in the human body. Number 8. Name the major nerves that serve the following body areas. Number 1. Deltoid muscle. It is the axillary nerve. Number 2. Diaphragm. It is the phrenic nerve. Number 3. Posterior thigh. Sciatic nerve. Number 4. Lateral leg and foot, common fibular nerve. Number 5. Flexor muscles of forearm and some hand muscles, the ulnar nerve. Number 6. Flexor muscles of arm, musculocutaneous nerve. Number 7, lower abdomen and anterior thigh, femoral nerve. Number 8, triceps muscles, radial nerve. And number 9, posterior leg and foot, the tibial nerve. And now I'm passing the floor to Miss Daniela Carian.
Thank you, Faisal. So, good day, everyone. I'm Daniela Carion, and I'm going to report about the human reflex physiology. So, number one, define reflex. Reflex is a rapid, predictable, involuntary motor response to a stimulus. Number two, name five essential components of a reflex. Receptor, sensory neuron, integration center, motor neuron, and effector. Number three, in general, what is the importance of reflex testing in a routine physical examination? It allows the condition of the nervous system to be assessed. It helps to indicate the generation of pathology of portions of the nerves and can help pinpoint an area of a spinal cord injury. Next. Number four, use the key terms to complete the statements given below. So reflex classified as somatic reflexes include calcaneal reflex, corneal reflex, patellar reflex, and plantar reflex. Of this, the simple stretch reflexes are patellar reflex and calcaneal tendon reflex, and the superficial cord reflex is plantar reflex. A reflex classified as an autonomic reflex is the pupillary light reflex. Number five, name two cord mediated reflex, patellar reflex, and cross extensor reflex. So name one semantic reflex which has the higher brain centers participate. Pupillary light reflex. So next, I'm passing the floor to Miss Castillo.
Yeah, see. Better.
Number 1. Several accessory eye structures contribute to the formation of tears and or help lubricate the eyeball. Match the described accessory structures with their secretion by choosing answers from the key. Number 1 is mucus, which is the conjunctiva. Number 2, oil, which is the tarsal glands. Number 3 is salt solution, which is the lacrimal glands. Number 2, the eyeball is wrapped in adipose tissue within the orbit. What is the function of the adipose tissue? Our answer is adipose tissue protects the eyeball from outer environments and works as a cushion for the eyeball. Next, why may it be necessary to blow one's nose after crying? Our answer is some percent of your tears is released into the nasal lacrimal duct, then sent to the nasal cavity. This makes your nose secrete fluids. 4. What is a sty? A sty is a red, painful bump that forms either on or inside the eyelid near the edge of the eyelashes. It is an inflammation in the tarsal gland or an infection on the sebaceous gland of the eyelid. What is conjunctivitis? It is the inflammation of the conjunctiva. 5. Which 7 bones from the bony orbit? Our answer is the sphenoid, frontal, zygomatic, ethmoid, lacrimal, maxilla, palatine. Identify the letter structures on the diagram by matching each letter with one of the terms listed below. Letter K is the anterior segment containing aqueous humor. Letter P is bipolar cells. Number 3 is ciliary body, which is letter D. 4J, which is the ciliary zonule. 5, letter G, which is the choroid. 6, letter A, which is the cornea. 7, is fovea centralis, which is letter M. 8. Ganglion cells, which is letter O. Number 9, iris, which is letter L. 10. Lens, which is letter B. 11. Optic disc, which is letter N. 12. Optic nerve, which is letter I. 13 is photoreceptors, which is letter Q. 14, retina, which is letter H. 15, sclera, which is letter F. 16, scleral venous sinus, which is letter C. 17 is vitreous humor in posterior segment, which is letter E. Notice the arrow drawn close to the left side of the iris in the diagram above. What do they indicate? Our answer, the flow of aqueous humor from the ciliary process of the ciliary body to the scleral venous sinus. Number 7. Match the key responses with the descriptive statement that follow. Number 1. It attaches the lens to the ciliary body. Our answer is ciliary zonule. Number 2. Filling and filling the anterior segment of the eye, which is the aqueous humor. Number 3, the blind spot, which is the optic disc. 4, contains muscle that controls the size of the pupil, which is the iris. Drains the aqueous humor from the eye, which is the scleral venous sinus. 6, layer containing rods and cones, which is the retina. Substance occupying the posterior segment of the eyeball, which is the vitreous humor, forms most of the pigmented vascular layer, which is the choroid. Tiny pit contains only cones, is fovea centralis. 10. Important light bending structure of the eye. Shape can be modified, which is lens. Anterior transparent part of the fibrous layer or your window on the world, which is your cornea. 12. The white of the eye is your sclera. Number 8. The intrinsic eye muscles under the control of which of the following? Our answer is the autonomic nervous system. Number 13. Match the terms in column B with the description in column A. Light bending, our answer is refraction. 2. Ability to focus for close or under 20 feet vision, which is accommodation. Normal vision is emmetropia. 4. Inability to focus well on close object or farsightedness is hypertropia. Nearsightedness is myopia. 6. Blurred vision due to unequal curvatures of the lens or cornea is astigmatism. 7 is visual movement of the eyes during the focus on close objects. Next, I will be passing the floor to Miss Felicity Di Carlos.
Thank you so much, Miss Caspilia. So let's move on to the ear and the hearing and the balance anatomy. So number 20, select the terms from column B that apply to the column A description. Number 1, this is the collectively I mean this collectively called the auditory ossicles, which is the hammer, the malleus, the anvil or the incus, and the stirrup or the stapes. Number 2, ear structures involved with balance. This is the cochlea, the semilunar canals, and the vestibules. Number 3, transmits sound vibrations to the ossicles. This is the tympanic membrane. Number 4, the three circular passages which in a different plane of space, which is the semicircular canals. Number 5, this transmits the vibratory motion of the stirrup to the fluid in the inner ear. This is the oval window. Number 6, the passage between the throat and the tympanic cavity. Our answer is the pharyngotympanic tube. Number 7, this is the fluid contained within the membranous labyrinth, which this our answer is the endolymph. Number 8 is involved in equalizing pressure in the middle ear with atmospheric pressure. Our answer is pharyngotympanic or auditory tube. Let us move on to the number 21. Identify all indicated structures and ear regions that are provided with leader lines or brackets in the following diagram. Please refer yourself to the screen. So as you can see the auricle or pinna, the tympanic membrane or eardrums. In the middle, you can see the middle ear. Also, you can see the internal or inner ear, the semicircular canals, the vestibules, also the vestibulocular nerve. Also, you can see the oval window, the cochlea, the round window, the pharyngotympanic or auditory tube, and also the auditory ossicles, which consists of the stirrup, anvil, and the hammer. And also you can see the external acoustic meatus or the auditory canal or external outer ear. Number 22, match the membranous labyrinth structures listed in column B and the descriptive statements in column A. As you can see in the column A, number 1 contains the spiral organ of the corti. This is the cochlear duct. Number 2, sites of the maculae. This is the saculae atricle. Number 3, hair cells of the spiral organ of corti rest on this membrane. This is the basilar membrane. Number 4, gel-like membrane overlying the hair cells of the spiral organ of corti. This is the tectorial membrane. And lastly, number 5 contains the crystal ampullaris. This is the ampulla. Number 6, the function in static equilibrium. This is the saculae utricle and the otillates. Number 7, the function in dynamic equilibrium. This is the ampulla, cupula, the semicircular ducts, the vestibular nerve. 8, this carries the auditory information to the brain. This is the cochlear nerve. Number 9, gelatinous cap overlying hair cells of the crista ampullaris. This is the cupula. And lastly, the grains of calcium carbonate in the maculae. This is the otillates. Number 23, describe how sounds of different frequency or pitch are differentiated in the cochlea. Our answer is different pitch sounds stimulate different areas of the spiral organ. The frequency is differentiated by the length and tension of the basilar membrane fibers. High pitch sound make it close to the oval window. Low pitch further up basilar membrane near apex of cochlea. Number 24, explain the role of the endolymph of the semicircular canals on activating the receptors during angular motion. Our answer is the endolymph moves more slowly than the cupula, causing it to bend, which activates the receptors. The endolymph flows past the ampular cupula, pushing it in the opposite direction of body movement and causing the hair cells to bend and depolarize. 25. Explain the role of the otillates in the perception of static equilibrium or the held position. Otillates provide weight and under the influence of gravity pull on the otolite membrane, which moves the hair cells causing action potentials. So number 33, describe the cellular makeup and the location of olfactory epithelium. The olfactory epithelium occupies in the roof of the nasal cavity. Number 34, name 3 sites where receptors for taste are found and circle the predominant site. So we can see the pharynx, the inner surface of cheeks, and the papillae. And the predominant site is the papillae. Number 35, describe the cellular makeup and arrangement of taste bud. So taste buds consist of both gustatory cells and basal cells. They are located deep between circumvallate papillae. 36. Taste and smell receptors are both classified as chemoreceptors because the both respond to chemical in solutions. 37. Why is it possible to taste substances if tongue is dry? Impossible to taste substances if tongue is dry. It is impossible because foods must be dissolved in solution to excite the taste receptors. 38. Name three factors that influence our appreciation of food. Substantiate each choices as an example for the laboratory experience. So the smell, we cannot taste if we cannot smell. So smell would definitely affect our appreciation. Number 2, taste. We would not know what tastes good or bad if we could not taste. So taste is an important source of appreciation. Texture. The perception of taste is helped by texture. This assists with sensory information regarding what we eat. Expand on your explanation and choices by explaining why a cold, greasy hamburger is unappetizing to most people. When hot, a hamburger is juicy and has an inciting aroma. When cold, fat congeals, giving the hamburger a greasy taste and texture, and this can interfere with the taste bud's ability to function. The cold grease can't be readily dissolved, so it's unappetizing. 39. How palatable is food when you have a cold? Without the ability to smell, you also wouldn't be able to taste properly. Thus, food is not palatable. Explain. With olfactory block, it's difficult to distinguish between different tastes, so when having a cold, there would be a reduced sensation of taste. So,
So for the deep dive, we are going to present videos for the activities that was requested or required in our worksheet.
Good day everyone, I'm Daniela Carrion, and for this video, I'm going to perform cranial nerve assessments. So the first cranial nerve is the olfactory nerve. So this is sensory type and its function is smell. So I'm going to ask the client to close her eyes and identify what I am holding by smelling it. Coffee. So correct, it is coffee. So the second cranial nerve is optic. It is sensory type and its function is vision and visual fields. So I'm gonna request the patient to cover his right eye with his palm. So what line do you see?
ADEFPOTEC.
So next is his left eye. What line do you see?
ADEFPOTEC.
So now read with both eyes.
ADEFPOTEC.
So his vision is 20/20 since he can read with his both eyes in line 8. So third is the oculomotor. It is motor type and its function is extraocular eye movement. So I'm going to assess the patient's 6 ocular eye movement. So I'm going to hold the pen 12 to 14 inches away from the nose. So ma'am, please watch the pen as I move it and don't move your head. Just use your eyes only.
That's it. Fourth is the trochlear cranial nerve. So it is motor type and its function is EOM. Specifically moves eyeball downward and laterally. So I'm going to assess the 6 ocular eye movement. So 12 to 14 inches away from the nose. So fifth one is the trigeminal ophthalmic branch. So it is sensory type. Its function is sensation of cornea, skin of face, and nasal mucosa.
While the client looks upward, lightly touch the lateral sclera of the eye with sterile gauze to elicit blink reflex. To test light sensation, have client close eyes, wipe a wisp of cotton over client's forehead and paranasal sinuses. To test tip sensation, use alternating blunt and sharp ends of a safety pin over same areas.
So for maxillary branch, it is sensory type and its function is sensation of skin of face and anterior oral cavity.
So a client looks upward, lightly touch the lateral sclera of the eye with sterile gauze. To test light sensation, have client close eyes, wipe a wisp of cotton over client's forehead and paranasal sinuses. To test dip sensation, use alternating blunt and sharp ends of a safety pin over same areas.
So for mandibular branch, it is motor and sensory type. Its function is muscles of mastication and sensation of skin of face. So I'm going to ask the client to clench its teeth. So the sixth cranial nerve is the abducens. It is motor type and its function is EOM. So I'm going to assess the directions of gaze. So 12 to 14 inches away from the nose. So the seventh cranial nerve is facial. So it is motor and sensory type. Its function is facial expression and taste. So for facial expression, I'm going to ask the patient to smile and raise her eyebrows. So for the taste, the client must identify various tastes placed on tip of her tongue. Sorry. So that's it. So for vestibular branch, it is a sensory type. Its function is equilibrium. So the client must perform the Romberg test. So it is orthopedic test to test your patient's balance.
Can you see the patient is performing the Romberg's test and she's gonna hold that position as long as she can, up to 30 seconds.
Cochlear cranial nerve branch is a sensory type and its function is hearing.
Tuning fork can be activated by flicking it between your fingers and by tapping the tuning fork on the knee. So position A, this tests air conduction. And position B, or bone conduction, tested by placing the tuning fork on any bony area surrounding the ear.
So, glossopharyngeal is a motor and sensory type. Its function is swallowing ability, tongue movement, and taste. So I'm going to place various taste on patient's tongue. And she is going to move her tongue from side to side and up and down. So vagus cranial nerve is motor and sensory type, and its function is sensation of pharynx and larynx swallowing and vocal cord movement. So the patient will identify various tastes placed on his posterior tongue.
It is sour.
So that's it. In accessory cranial nerve, it is a motor type. So its function is head movement and shrugging of shoulders. So I'm going to assess the accessory cranial nerve. So for hypoglossal cranial nerve, it is a motor type and its function is the protrusion of the tongue, moves tongue up and down and side to side. So the patients will perform it. So she will going to move her tongue from side to side.
And that's it for today's report. Once again, we are the Group 2 from DDC BSN1-11F. We hope that you've learned something from this video. God bless and have a nice day ahead.